UMANG, the group called Empowering Medicos, have been conducting various programs, almost nearly 18 programs we have conducted in the last 2 years. And we have addressed issues like interpersonal relationship, how to have better communication skills, and so on. And in fact, today also we have come with a very interesting topic called as medical jousting. I have my co-host here, Dr. Gautam Goel, who is a general and laparoscopic surgeon. His interest has been the abdominal wall repair and hernias. He has been doing microinvasive surgery for almost last 2 decades. He's been attached to various hospitals like Somaya Super Speciality Hospital, Critical Hospital, and Sushosha Hospital. And now I hand over this mic to him, who would introduce our stalwarts and speakers for today's sessions, who would take you to the journey of the topic called medical jousting. Gautam, please.
Thank you so much, Dr. Shetty. Actually, I'm more comfortable calling you sir because we've pretty much learned at some point from you. And number one is I'd just like to thank the entire team at UMANG for having invited me to moderate this event. In fact, when Dr. Pinky Thapar called me up, I had a very, what should we say, a very confused sureness about hosting the program along with you, because I say confused sureness because I was sure I wanted to share that, you know, the screen space with Madam, yourself, Dr. Rajadaksh, and I wouldn't leave this opportunity ever. And confused because this is actually a topic which we do not have enough references on also. We all have heard about it, but nobody's really delved into it in depth. We really don't know how to take it further. We are kind of in that confused mode of mind as to where we are headed in terms of what this situation is also. And what better for us than to have Professor Rajadaksh, who's basically professor of Department of Vet Medicine. He's head of the medical oncology department and in charge of the hypertension clinic at TN Medical College and Nair Hospital. He is the president of Maharashtra Association of Physicians, vice president of IMA Mumbai branch, and many, 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 many more accolades to his thing. So he's going to be one of our, what should I say, path showers in this process. And besides that, I have a lot of, what should I say, I'm extremely proud to introduce Madam as well, who's been an extremely huge influence in my life. I've been lucky to have worked with her. Madam is basically, I mean, I don't know how to introduce her to people who know her as much as me or maybe even better. And Madam has been the head of department at Sion Hospital for the longest time. And she has actually, you know, she's kind of been working in traumatology. She set up the venous disorder clinic. She's set up the burns unit, which was eventually recognized at one stage as the best burns unit in the west of India. And she has, you know, it's actually been a baby for her, and I've seen her nurture that. And she's even set up the first skin bank where cadaver donations of skin could be made. She's basically been making a difference to the world. And so who better than her to guide us through this process? May I please request the speakers to, including Girish sir, to please put the video on, because we would love to see you while we listen to you, sir. Thank you so much, sir. Thank you so much, sir. So I'll start with the first question, if I have your permission, Dr. Shetty.
Yeah, please go ahead.
So once again, sir, how would you define medical jousting, and how was this extremely strong terminology coined?
See, as if you see the, am I audible?
Yes, sir, you're very audible.
Okay. So first of all, good evening, everybody, and thank you, Mukesh, Gautam, and Team UMANG for inviting me here. It's really very novel topic, and I'm so thrilled to discuss it with all of you. See, as you know, the jousting, as they say, is basically two warriors on the horseback with the lances. They're fighting with each other. There's a real dictionary meaning of the word jousting. But here, when you say medical jousting, it is you know, criticism of a previous doctor. Suppose you get a patient and he was taken previous treatment from some other doctor in the past, and when he comes to you, you badly criticize that doctor, you know, and you say, I would not have given such treatment and all these things. So such particular criticism is called medical jousting. So that is, if you see the in general meaning of the word medical jousting.
Yeah, so till Madam joins, probably we'll take up another question with Girish. That yes, I mean, we define this term called medical jousting, where one uses a derogatory remark to one another. But what is this incidence? Is it really worrisome, or it is just the hearsay entity?
Actually, yes. As far as incidence is concerned, nobody really knows the exact incidence. But I've come across few articles, and one of them mentions that they found 67% doctors were really involved into this medical jousting. So that is quite high. 67% is quite high. About 29% only were supportive to the previous doctors, saying that this happens in medical treatment. It's not a perfect science and all these things. And about 4% were neutral. So you can say incidence, if you ask me, that particular article mentions, which has done this small study, that about 67% doctors are involved in the medical jousting.
Okay, and when you say incidence is of course very high, but what are the different types of jousting? Because we hear that, is it just the bad mouthing between two doctors? Is it between doctor and patient? Is it doctor and some other healthcare worker? How you actually have different categories of medical jousting?
So, if the patient is there, patient relatives are there, patient comes to you, he has taken previous treatment from some other doctor, and now in front of the patient's relatives and in front of other doctors also and other paramedical staff, you start criticizing that particular doctor's treatment and the doctor in a derogatory manner. So that is very bad. So the tone, your body language, everything is important, and what words you use. So if you see the types, one can say it's something like direct verbal type. Direct verbal means you openly criticize with harsh words. So, like you instigating that particular patient or his relative, saying that you must take legal action against that doctor. So this is called direct verbal jousting. The other thing is indirect verbal. Indirect verbal means he will not say he will not use harsh words, but will say, see, I would not have done all these things. I would have treated the patient differently. This is, that is the indirect way of doing it. Then thirdly, your body language. Like you make some faces, horrific faces or surprise. How, you don't utter any word, but you make the face that, what is this treatment? I would never give such treatment. Yes, yes.
Yeah, madam.
So that is called body language, by expressing by your body language without saying anything. The fourth is you write in the patient's records, patient notes you write that I received the patient from, patient had taken treatment from this doctor in the past, and this doctor has given such and such wrong treatment. So that is called written jousting, which you write in the patient's records. And the last one is you don't write in the patient's records, but then there are social media and doctors groups, some websites on which you criticize that doctor, saying that, suppose I say, I know this particular doctor right from his, postgraduate days when he was a resident, and he was a idiot, and he used to make all these mistakes, and he used to get scolded by his seniors. And now also he has remained like that. He has not learned anything. So such kind of thing, he writes on the, some website or some patient's social media and all these things. So these are the various different types of doing or indulging into medical jousting.
Yeah. So Gautam, you take now the question for madam, the third one.
Yeah. So madam, I'll ask you this. What, according to you, would be the repercussions of this practice of medical jousting? One, on the person who's jousting. Two, on the person who's jousted. The patient who's actually stuck between the thing, and the medical fraternity on the whole.
The person who is jousting is obviously trying to do it to prove his superiority, and trying to pull the legs of the one who has treated the patient previously. And this may be out of jealousy, or this may be out of competition that we see every day around. And he wants to increase his practice, he or she, whosoever. And so that is why he's trying to criticize the way the patient has been treated previously. I think for the patient, it's a very peculiar situation. Patient is kind of exposed to this fight, I would say, between the medical professionals themselves. And that would confuse the patient. Of course, patients today are extremely smart, and they might use it to lodge a case against the first medical professional who treated him or her. And that is the biggest problem that can be created by jousting. And that we all should keep in mind, that we are degrading our own profession by passing such disparaging comments against another individual from our profession. That is very important. We are also trying to downgrade the facilities that are available at certain places, which can have repercussions on patients' access to these facilities. So we need to think about that. And of course, the one who has been the victim certainly would suffer either in the form of losing his practice, or worse still would be in the form of having a legal battle going on against him.
Yes,
Yeah,
madam.
right.
Now,
And
And
the
overall,
other
in
thing which
terms
I
of the
want to add
healthcare
here
scenario,
is,
madam,
you
if we
can,
look at
you
it
can,
further in terms of the healthcare scenario, where do you see this taking all of us? And because I think the repercussions on in a larger group, let's assume I'm not jousted, but I've not jousted anyone either. How do I also fall prey to this system or the patient by himself? How would that happen?
I think we may or may not do it intentionally, but it might happen unintentionally also. So we need to be extremely careful when we talk to patients. And all of us, we know that some patients today, particularly in private setups, do keep their videos on or their mobiles on to record what we are talking. And this can spread like wildfire, and what happens is patients would be losing confidence in medical professionals, which is already happening, and it can continue to worsen. And this can lead to very great difficulties, not only for patients, but also for medical professionals, because then all the time, as such, we know that we are practicing to a great extent what is known as defensive medicine. Now, if this jousting goes on increasing, there would be a kind of fear in the minds of medical professionals also. So their decision making might get affected if this is what is happening or they're experiencing it. The team spirit gets affected, and the team may not be able to work appropriately. And particularly surgical field certainly needs a team that is very actively working together.
Thank you, ma'am. Dr. Shetty.
yeah, so basically the next question to madam is that sometimes we, as a senior level, I'm sure there must be cases referred from junior or from other centers, and you justifiably differ, in the approach of management by the previous one. But of course, we don't want to again be negative to him. So in this tricky scenario where you are justifiably differing from the treatment, but yet you are not likely to, use any derogatory remarks to your previous consultant, how you manage such situations?
I think there are two aspects of this particular issue. One is from the side of the person, suppose in this particular example, myself, who is looking at the patient second time or as a second consultant, and the first consultant also who has treated the patient. Probably on the side of first consultant, I would think that the precautions that he or she should take if the patient is being referred to a second consultant, or a patient has gone to a second consultant, and actually, in my opinion, at any time, whether patient goes to somebody else or not, the notes on patient's paper should be in great detail. So we can reduce the possibility of anyone getting jousted by anyone else. And if you're transferring the patient or discharging the patient, the note should be very clear that why you took this decision and what has exactly been done. And if you're referring the patient, kindly communicate with the person to whom you're referring to in very clear words that what was the issue and why the patient is being referred to this particular apparently higher center or more experienced person or trained person in a particular field. And same thing applies to references from a primary care center to an tertiary care center. I think as far as a person who is looking at the patient second time, if you really find that there is an issue or there was a real difference in the treatment that was given to that particular individual, rather than saying anything in front of the patient or the relatives of the patient, because that would certainly amount to jousting and may lead to further repercussions about this. It is better that you just tell the patient that, okay, this is the treatment that you need and you start this treatment, and make no comments about what has been done previously, because you don't know the actual facts. The patient may or may not be telling you the truth or may not have understood actually what has been done. And that is the importance of complete notes with the patient. So it's necessary that we understand the situation, we understand the facilities available at initial treatment center, and we should understand the expertise and confidence of the person who treated the patient initially. So without understanding that, we cannot pass any remarks about it. But when there is a real mistake, different modes of communication can be used. One is writing a letter or an email, which becomes very formal, and I personally feel that doing this is rather, what should I say, dangerous, in the way that you are leaving behind proof of your such communication with that person. So I don't really entertain that. But I certainly make it sure that I call the person and I talk to him, try to find out what was the reason why this particular method was adopted or treatment was given, and try to send a reference or try to send an article that would probably update him or her about what should be the appropriate way of treating that particular situation. So I think that's a way of enhancing everybody's level of understanding and probably giving information appropriately.
Yeah, so the same question which was given to Dr. Girish, that there are different ways and methods by which you actually pass a comment about your colleague. So what are different ways which you have encountered about delivery of such derogatory remarks between the consultants? Any such example you could highlight, madam?
You want me to answer?
Yeah, anyone. I mean, can we both? Yeah, Girish, you can take it up.
Yes. See, the thing is, we are working in medical colleges. Even madam was a professor for so long. The thing is, it is our job to critically analyze the prescription, the treatment which is given. But as we follow certain rules, that we should not make derogatory comments against the treating doctor from where the patient has come to us. So these are the strict instructions to my residents and my lecturers, that don't make such comments in front of the patient relatives. Of course, we can sit separately, and if you want to say something, you can say. That is number one. Because medicine, one, we have to remember, it is not a perfect science. Our teachers have taught us medicine is not mathematics. 2 plus 2 is usually not 4 in medicine. That we have to remember. And therefore, all of us are likely to make some mistake or the other. None of us is perfect. Okay. So that one, once we understand this, then our approach becomes little better. Basically, we are a type A personality, ambitious personality type. Usually, you are toppers from our class, our school, our district, and all these things. When we come to medical college, we know that all good students, very toppers, have come together. And then what happens if you are not able to cope up this particular race or a competition? Then somewhere the inferiority complex sets in, and this inferiority complex later leads to tendency to make the derogatory comments against somebody else. So that, suppose his practice is more than my practice, he is earning much more, then I will try to pull him down by making these derogatory comments. So first of all, we have to change ourselves there, because as I have told you, the jousting, though people may say I don't do all these things, but still this particular jousting is quite high. So if you want to make, because we are brought up in such a system in our college, Mukesh and Gautam also and madam also from the same institution, our seniors were allowing us to criticize their prescription also. So they used to encourage, but it should be polite and it should be nice way of discussing, and you can criticize. And same thing I've continued. Even you've asked my students also now, who are so much junior to me now, but still I've asked them, they can always criticize whatever I'm writing my treatment. So this criticizing the treatment is not bad. But if you make the derogatory comment, if you try to pull down that particular, defame that particular physician, that particular surgeon, that is wrong. So that particular message you must give to your junior doctors, and you must follow yourself. Because if you are making derogatory comments, if you're telling your juniors don't make derogatory comment, that will not work. So various things. For example, in medicine, if you see, there are patients who are coming with abdominal symptoms and they turn out to be coronary events. You know, this has happened. And suppose this has happened because this I have seen in my practice many times, and the doctor criticizes that this particular consultant couldn't diagnose coronary event, and he was treating for gases or he was treating for acidity on all these things. But remember, such mistakes can be made by many senior doctors also. So when you are making such comment, don't make such comments in front of the patient's relatives and patients, because that will create bad impression about the not only that particular doctor, but other doctors also, and in against medical community also. So I feel this, there are many examples which you can give, but if you follow this particular rules, then I think it will be good for all the practitioners.
If I can add something to what Girish mentioned just now. He is absolutely correct in saying that we should not be making any comments in front of the patients. I think another part of the same is that it's always the teacher who is keeping an example in front of his students. So the teachers need to ensure that their behavior is most appropriate, because the students are going to learn from teachers and they are observing the teachers all the time. Secondly, residents do make mistakes, we all know that, but we must take care that we pass no comments and we do not fire the residents in front of the patients. That's extremely important, because that also amounts to medical jousting, because we are firing our residents. Actually, we are kind of degrading the residents in the eyes of the patients. And then the patients don't believe in what the residents tell them to do or what the residents do for them. So this care, I think each and every teacher needs to take, or each and every senior, whether it's in medical college or it is in private practice, needs to take is, please don't make any derogatory comments about your assistants, your juniors, your colleagues, your staff, anyone who is working with you in your team, because that can lead to problems in patient's mind, and patient may not remain compliant with the treatment, or particularly may lose his confidence in the people who are treating him.
That's absolutely correct. I think it's so important here. Madam, I'd like to actually push across another question to you over here, because like the way we've discussed in the Medical Institute as a teacher-student relationship also, this is an important thing. I just want to ask you, how does this practice of jousting change in other scenarios also? Like as in, like coming to a generalist, going to a super specialist, and how does this jousting kind of change in terms of how it's practiced? And also, does the pattern change, if at all, if this jousting happens in a private institute or a corporate setup versus in government hospitals? How does the essence really change? Because it's not about acquiring patients at all in a government hospital, because you already have them. It's probably about something else. So how does it change in these scenarios?
I think in a medical college setting or in public hospitals, jousting happens probably little to a lesser extent than in private practice, because most of us, we know each other in the hospital. We know the way other person works. We know the capabilities of most of the individuals, but most of the times this happens not within the same specialty, but between different specialties. For example, surgeons criticizing gynecologists is probably the commonest kind of thing that I have seen. And particularly when we worked in the days when there was no ultrasonography, and even diagnosing ruptured ectopics was basically done clinical grounds, and we had no way of confirming it unless the patient's abdomen was open. And that time, this would happen pretty frequently about criticism. But what does happen is it's very easy to criticize public hospitals, and this happens at the hands of private practitioners and private hospitals also. We must realize that what this leads to is that even poor patients tend to move away from public hospitals, and they cannot really afford treatment in private setups, but they think that there is no other go for them. So they'll collect money from somewhere here and there, and whatever can be done very easily in a public hospital, they tend to spend a lot of money and go through a lot of trouble in getting it. I'm talking about financial trouble in getting it done in a private setup. So that does happen pretty often even now. So that is something which I always feel bad about. So I think somebody is talking pretty loudly. Can the person please mute himself?
Can you all please unmute yourself?
So this, and again, coming back to your point, Gautam, that is there jousting that happens between a primary care and a tertiary care center or a secondary care center? It's very easy to pass comments, but then most of us working in a tertiary care center know the limitations that the doctors face at a primary care center. We know that there are many things that are not available. Many vacancies are there. There are no support systems in these places. So the primary care physician has to do the best that he or she can and then refer the patient to a tertiary care center. So if you understand the situation, you will never try to pass comments on a person. Actually, I feel sorry for these people who still work in situations where there are a lot of compromises need to be made. But then what we can do to reduce their problems is continue to teach them, keep them updated, keep communication with them. And we did that exercise in Sion by training district hospital surgeons. And we improved the communication between us. And the transfer of trauma patients or burn patients that we would receive improved a lot because there was communication between people working in district hospitals and people like us who are working in a tertiary care center. So I think from our side, we need to go out of the way also sometimes and make efforts to establish communication, improve the facilities, improve the abilities at these primary care centers. If I can take another minute of yours, can I?
Yes, please, ma'am.
I would share something which I had to face at Sion. We had a consultant surgeon working in private setup who had, I can use a very, very bad word, but I will use just the word agent, and I'm sure all of you will understand the meaning. Agents in the hospital, and that particular consultant would come and see the patient. It's very easy to walk in a general hospital and move anywhere and see patients. We would walk in the wards and go and see the patient, talk with the relatives and tell them that, oh, nothing will be done here well and there is no expertise here and no facilities here. I will shift your patient outside and I will do all the necessary things. I realized that this was happening routinely, and those who have worked with me know that I am strong enough. And I reprimanded that particular person and also the agents, and this led to significant changes that occurred in this particular service. So this is a worst kind of medical jousting, in my opinion, that you're actually trying to go to that place and trying to do this just to serve your own purpose and to earn some more money.
Boy. This is actually sad and surprising that you went through this, ma'am. And but thanks for sharing this, because I think we can all be very careful about these situations also. Sir, I'd like to put across a question to you. What are the legal implications of this medical jousting, sir? Are there any guidelines by the medical councils, the NMC now or the Maharashtra Medical Councils in the code of ethics on this important issue?
Yeah, but before coming to that, what Madam said, there is one more type also which we have to consider, and then we can go to the legalities.
Sure, sir. Sure, sir.
That there are some doctors in private or in government setup or medical college, they may genuinely feel that this particular patient is given wrong treatment. And sometimes it may happen the patient and the relatives may ask him direct question that they are not happy with the treatment, and they think that the treatment given by the previous doctor was not good. And this fellow also is because it sometimes.
So you've gotten muted, sir.
Yeah.
Okay. Because this story was told to me by one senior professor from one of our municipal medical colleges. So he said one of his interns, his brother was admitted in a big hospital for indigestion. Okay. And he was told that you are having coronary event, acute coronary syndrome, and urgent angiography is required. So he said, okay, because his age was around 38, 39, his brother's age. I mean, so he underwent that particular thing. And he contacted this particular professor. The professor said, okay, you get the CD. That time it was CD. So that you get the CD of the angiography done, and we'll see really there is this thing. They were saying there are many blocks and he has to undergo angioplasty immediately of the 3 vessels. And the estimate was also, quite huge. So they were not willing to give the CD. So this happened for about 1 or 2 hours. And ultimately the professor said, you get the patient to our medical college. And he took against medical advice, and the patient was brought to the medical college. And there the angiography was done by the cardiologist in that medical college, and all the coronaries were absolutely normal. So suppose such and such incidents happens, these are happening, once you have to accept. Now, and he feels that, and patient asks you direct question. He is not doing jousting on his own, but he was asked directly by the patient, the relatives, this particular thing, wrong treatment is being given, or irrational treatment is being given, or unnecessary investigations are being done. So there, what the person should answer, and whether if he answers them the facts, whether that will be considered as medical jousting. So that is also another thing, another aspect, which I think if we're discussing this particular topic, we have to consider. It is not always somebody wants to pull somebody down and make the derogatory comment to show his superiority and all. But sometimes it may be genuine also. So we have to see the other side also. So with this, any one of your madam can comment on this. As far as the question was concerned, yes, if you see the Medical Council of India way back in 2002, have mentioned, and now it is NMC obviously, in their code of ethics, it has said that medical jousting is considered unequivocally unethical. So that is the word which are used, unequivocally unethical. And it also mentions very clearly that no criticism, okay, on the previous doctors should be carried on in presence of the patient or his representatives, means relatives or any other representatives of the patient. So taking in consideration the Declaration of Geneva also, if you see that every colleague should be considered as brother and sister, and no enmity or jealousy should be kept. So these are the clear guidelines which are given by Declaration of Geneva also, and Medical Council of India or NMC also. So I think we have to follow this. Basically, you should be a good human being. If you are a good human being, then everything, because they say, whether it is allopathy or homeopathy or any other pathy you practice, no pathy will work if you're not a sympathetic and empathetic person. So sympathy and empathy is not there, no pathy will work. So basically, if you're a good human being, you will not indulge into jousting at all. And we know such, those who indulge in jousting, their trends or their tendencies or their biases are different, and they are different people. Whereas the nice people will never indulge into this. This is our experience for last 35, 40 years. And you all will agree with me.
I think Geneva should change one line that every medico should be considered as brother and sister, because high incidence of medico marrying medico. So everyone cannot be considered as brother and sister.
Yeah.
So anyway, we go ahead with our next question, and this question is to Girish Adish again. So is there any curriculum in our institute currently including training right from undergraduate days? Is there any method by which we sensitize them that these are the issues you are likely to face in your practice? So it's high time that it should be included. What are your comments?
Madam has beautifully said, you have to set an example. Suppose you cannot teach your child that you should always, truthful and all this thing, and all the time you're abusing and you're, lying. So then that will not work. So you have to behave like that yourself. A teacher should be like that. Then only, just preaching will not help. That is number one. As far as the curriculum is concerned, now, there is a subject, medical ethics, because they say the students will study only that which is asked in the exam. Okay. And therefore, the one question of medical ethics is now included, like research is included. Similarly, medical ethics also included. But remember, this will give you just the theoretical aspect. Actually, when these students, undergraduate students, come to the ward and they join rounds with you or they attend OPD with you, how you behave and you set an example, that is going to be more important than including anything in the curriculum. That is what I feel.
Madam, what are your comments?
I think Girish is right. And another thing, as I understand, because I retired quite a while back, but I think the new curriculum includes communication skills too. And that, along with medical ethics, should really prepare the students to face such situations. And students hopefully should understand that how they should behave when they're talking with the patients and what kind of attitude should there be about other practitioners. Because I think basically jousting comes out of jealousy. Jousting comes out of being over ambitious. And unless we train ourselves to relax and live comfortably and amicably with everyone, this will not probably stop. And what Girish had mentioned earlier about the incidence of jousting, and we all probably have read the same article, that particular this study was about patients with fear lung, and it was like a sting operation actually. And 67% of medical professionals were found to be jousting. So that is something phenomenal number and really shameful, I think, for our profession.
We absolutely agree, ma'am. Actually, it's so important and for us to be very conscious about what we do, even unintentionally. Because some of us, even with the best mindset, might actually, if you're not conscious about it, we may actually slip into that without realizing.
Yes.
I'm actually going to put this question across to both of you, ma'am, sir, Dr. Girish, and yourself. You've already kind of expressed one encounter of jousting that you experienced in the hospital. I'll put this question to sir first, and maybe you could add another example if you've had any more. Have you ever encountered or been a recipient of jousting? And if at all, then how did you feel at that time? And how did you respond? Madam expressed about the one in the wards. Any experience that you've had? And if you haven't, then how would you respond?
Luckily, I never had such experience. At least my patients went to various, must have gone to so many doctors afterwards, and even if they would have criticized my treatment and me, but they have not come back and told me that. So that way, but see what happens, especially if you are young consultant, young doctor, it will affect your morale, definitely, because initially our practice is not that much. We are not earning that much. See, ultimately your confidence is boosted by your success, by large number of patients which you treat, and you earn a lot of money. That really gives you, whether you agree or no, but money boosts your confidence, and money will come only from doing big practice. In the initial stage, when you are not a big name, if these incidents occur with you, it will affect your confidence. And once your confidence is gone, you will not be able to do good practice. You will be, what madam used correct word, defensive practice. And defensive practice means unnecessary investigations you will do. You will worry, my patient will drag me to the court of law and all these things, consumer court and all these things. And therefore, the doctor must practice freely, with full confidence, with free mind. Otherwise, the quality of his consultation will not be good. So that is then, and of course, litigation and physical attacks and damaging the property of his hospital and the clinic. All these things are what Madam said, repercussions and what can happen to the person who's getting jousted. So I think these are important things according to me.
Madam, any other experience in jousting that you might have ever had?
Not that I know of. I mean, patients do doctor shopping or surgeon shopping, I should say. And I think that's one of the aftermaths of this kind of medical jousting, that patients don't develop confidence in one particular person, and they don't rely completely because they feel that, oh, I don't know whether I'm getting the right treatment or not. But then invariably they roam here and there, and then they'll end up back with me after maybe 2-3 years also sometimes, but they do come back. So I have personally not experienced that, but I have observed some different type of jousting. And this takes us to the other end of the spectrum, or I should say, like Girish was talking about young people. I'm old now, so I think I should talk about old people. This I have heard and seen that some in between age people do pass comments about older people that, oh, he or she is now old, they don't practice, they're never here, and rarely, it's difficult, they can't attend emergencies, they're aged. I think this is a kind of medical jousting. So this is a method of diverting patients from one professional to another, which in my opinion does amount to medical jousting. So it may not really be passing comments about treatment that has been received, but it is very much on a personal level, which is even worse in my opinion.
Can I ask you a little sensitive question here, but I'm going to go ahead because I think no better person than yourselves to answer this.
If I wish to answer, I will.
Have you, ma'am, ever in the process of what might have been a very conscious and constructive criticism slid toward what you might today call jousting yourself and realize that? Have you ever been in that situation?
I don't recollect any such situation, though I do feel extremely disturbed when I really see something which has grossly gone wrong. But then I just take the easy way out and tell the patient that, see, whatever has happened, there is no point in discussing those things now. So we'll take it up at this particular point of time and go ahead from here.
It's a wonderful way to do it. Sir, anything on your side where you probably felt at some other point that maybe it was a little more than just...
Now I'm thinking, when you ask me whether you were jousted anytime, I think not me, but all of us, this is not medical jousting. I don't know what is the definition. Some jousting only. What Amir Khan did in Satyamev Jayate.
Yeah.
Against entire medical fraternity,
Yes.
So there I felt really hurt, because
So that Girish happens in so many movies. Why only Satyamev?
But that was a program with a very huge viewership,
Yes.
Yeah.
So that was a big blow to the medical professionals.
Yes.
Yes, correct. So basically, even social media is the picture of
they paint doctors in the most worst way that one can.
In fact, ours is the only fraternity where people are doing charitable practice, honorary practice. How many other professionals do that? Nobody.
Yeah.
Advocate, what are the charges of advocate? I don't want to name any particular professional, but and doctors charge 2,000 rupees also, and you feel that they're after money. So this is, I don't know why only doctors should do charitable work. But in spite of that, our image is getting spoiled. And main reason is we are not united, and we criticize our own colleagues. So that is the
Exactly.
reason. And therefore,
That's
this
something
particular topic you have taken up today is extremely important.
Yes. So I think that's one very strong reason to plead that we should not do medical jousting, because we are dividing our own faculty and our own professionals. So it's probably we all need to come together more appropriately and try and face the situation as it is today in society, and make ourselves safer and make ourselves more confident to practice our profession appropriately, rather than being under tension of being victims of multiple factors and multiple types of attacks.
Yeah, so now in fact we come to the last question, but then probably we'll open up the chat box, and if there are any queries from the audience, then we'll take them also. The last question is that it's again both you can answer those, that how do we really prevent this, and do you think that there's a better communication strategy required between medical professionals, and who would actually make those guidelines of better communication? So how we really break the ice and educate everyone that how to prevent this medical jousting? Are there any methods one can adopt?
As we have discussed, I just ask one question to my residents who join, okay, in my unit or in my department. How many of you brush your teeth before going to bed? And then they look down, So most of them, they accept honestly that they don't brush their teeth while going to bed. Only those do whose mother has given them this habit in their childhood. Remember. So these are the habits which you cannot develop at the age of 20, 25. These are the habits which are given by the parents or somebody when you are 5, 7, 10-year-old. Similarly, these are the habits. It's a responsibility of the medical teacher. That is what I feel. And I am trying to do it right from the day I became medical teacher. That you have to lead by example. You have to walk the talk. You have to behave like that. It is not just preaching. I have seen many preachers, okay, but they don't practice what they preach. And if you're like that, it is not going to work. So if I do like that, I restrain myself. Sometimes it's a very, very tempting situation, because we are brought up like that in medical colleges. We are brought up, how to criticize others. But if you refrain from them and say medicine is not mathematics, even I could have made this mistake. He must have seen the patient in different clinical scenario, and that's reason why he must have taken that particular decision, and he must have started this particular line of treatment. That way we should do, okay, rather than criticizing and making who is this fellow, he doesn't know anything, who has given him MD degree, MS degree. Such language is very, very dangerous language, and we should restrain ourselves from making such derogatory comments. So if we lead medical colleges, this is taught to the PG students and UG students during their medical college days. Later, even if you make laws and legal action and so many other things, MCI and MMC and all these things, it is not going to work. So that is my opinion.
I agree with Girish to a great extent. And I would just like to add that I'm sure that jousting occurs in other professions also. But we are medical professionals and we are different from others, and our profession is different from that of others, is something that we must realize from the day we step into a medical college. Because we are dealing with human beings, and not only with their physical health, but with their mental health too. Because this kind of jousting creates tremendous confusion in patient's mind and fear in the physician's mind or a medical professional's mind. So it is extremely necessary that we learn this right from the beginning and right from the time that we have started our medical education. We were discussing about how we can prevent this, or how we can hopefully reduce this particular occurrence of jousting. And I mentioned some methods earlier also, that detailed notes on patient's paper and the reason why this particular decision was taken, and on transfer note 2, and most importantly, regular updating of our knowledge, which is essential so that we, even by mistake, we don't waver from what is the recommended line of management of a particular condition. The management can certainly differ or may not be what has been ideally recommended for that particular condition, because the situation differs, the facilities differ, expertise differs, and abilities differ. So that is a thing which the second physician or second medical professional must keep in mind before doing this. And in fact, as I mentioned earlier, try to make an effort to find out what was the situation that made the first decision mandatory for that individual. Then only we will understand that what was the situation and why this decision was taken. And after all, we need to decide that we all are human beings. We all are liable to make mistakes someday or other, and we all are likely to fall victim to this. So be careful that you don't be the reason for somebody else's pain.
Thank you, madam.
Right.
And thank you both.
I would, sorry. Dr. Shetty,
Yeah,
I just wanted to actually add a comment over here. I was in a conversation with a very senior colleague of ours who is also the part of the MMC. And my question to him was that we have this topic coming up and there's so little known about it other than, we've really not had such a deep insight as yet about this. And I asked him, how does this work? Do you have any comments to make? So he mentioned that in the MMC, out of 10 odd patients who come in with some complaints, when they ask him, why do you feel your treatment was wrong? Their answer on majority of the cases, which is 9 out of 10% of the cases, is that our second doctor told us that the previous doctor had messed up. And he went on to say the next thing. He says, in the MMC, we are smart enough at least to understand that we don't take hearsay. So when we ask them to get a written statement from the second doctor telling us exactly what was wrong and how he would have treated it, so the sad part is it is not only a critical comment, it's usually a very loose and a casual comment, which is likely to actually destroy somebody's house or his profession or his morale. And here we've still not looked at the confusion that we might be creating in the patients while they're undergoing jousting, not figuring out whose opinion he's got to pick up actually at that point.
Yeah.
That's really sad, because then it is only for personal gains and not really in the interest of the patient.
But these are habitual jousters, okay, and they get sadistic pleasure out of it. So I think they need some legal action. Or
I think they need to pamper their egos.
Yeah.
So one more entity added today, habitual jousters. Probably will add to
it is in literature. I have gone through it. It's in the literature.
Okay. So any question you'd like to take up from the chat box, Pinky or Alpa, you have gone through any questions on chat box which you'd like to ask to our speakers?
No, everybody is very appreciative of the whole session.
There's one question about if some surgery has been done wrong, how do we say to the patient that it is wrong or it's incorrect? One question is put in the chat box. Madam, you can answer this.
I think unless we know the real facts, because the patients may not really tell you, or they may not understand actually the details of what has happened. And so just believing in the patient and giving any opinion is incorrect in my view, because quite often patients are also smart enough to conceal the facts, and it might be really their ignorance about the whole thing that they may not be able to give you the real picture. So unless one finds out what exactly was the situation, one should not be making any comments. One can just tell the patient that at present time, I would not like to make any comments. Then try to establish a communication with the first consultant and find out maybe if you're really interested. Otherwise, just avoid it.
No, one
Madam,
thing, I will just 1 minute because two eminent surgeons are there. I will ask this question to them because very often you would have come across some abdominal surgery was done, and then the patient comes after say few days or later with pain in abdomen, and you decide to re-explore and you find a mop over there. No, this has happened to many surgeons, that the mop was,
Right.
now the patient, now how you have to tell the patient that this surgery, second surgery was necessary, and that is going to cure the pain and all other problems. So that is the tricky situation because the patient will get extremely angry with the previous surgeon. And you also must have come across such incidents many times. Yeah,
Madam, I think you can answer this for us.
Very difficult. Yes, I have removed such mops, or sometimes instruments also. But luckily that time CT scans and such things were not there. So it was probably little easier than what it would be now. But then this is a gross negligence. And you do have to try and convince the patient that there are some things which do happen after surgery, and these are known complications or known problems that can be there in post-operative period or occur during surgical procedure. But this can certainly lead to the patient lodging a complaint in a legal battle. Then that's a completely different aspect of it, and you cannot conceal these things when inquiry goes on or a case is being heard in the court.
I think Dr. Pankaj Joshi wanted to ask one question. So can someone unmute him and he can ask verbally?
Yeah, I have unmuted myself. Can you hear me?
Yes, please go ahead.
So my question is, supposing you know a friend who is a lawyer practicing in the consumer court, and he is fighting a case for a patient, and he wants a medical opinion on a file, and whatever was done was not correct in your opinion, or a patient directly comes to you, patient wants to sue the first doctor, but he wants a medical opinion. He might even want to make you an expert witness in his case. What do you do?
Now, giving clear opinion as per my knowledge, I don't think it's a medical jousting. But you can always tell that this is not a perfect science. That is what my stand is. When I am asked many times, as a professor of medicine, many times it is asked in the legal battles. So I always tell that particular party, because that particular party is instigated by some doctor only, as our senior surgeon told him, who was a part of MMC. That, we should always tell medicine is not a perfect science. And medicine is not like engineering or like a mathematics based science. So 2 + 2 is not 4. Approach of various specialists in the similar case could be different. And therefore, and secondly, while giving any particular therapy, either medical or surgical, two patients may respond differently. One patient may respond very nicely, other patient may not respond at all, and third patient may respond adversely also. So these things happen in medical practice, and therefore we cannot straight away blame that particular doctor. That is my approach, which I am following.
Okay, I'll give you one example. Patient comes to me with a discharge card saying that laparoscopic bilateral hernia repair has been done. Okay, now he has a scar below the umbilicus and he has 2 scars on both groins of open hernia surgery. The mesh on both sides gets infected, and when you remove the mesh is in the anterior part of the muscles. It is not behind the muscles in the pre-peritoneal space. Now what he has told is totally false. He has not done a laparoscopic surgery. He has given the patient an extra scar below the umbilicus to look like a laparoscopic surgery, but there are 2 groin incisions and 2 groin infected wounds. So what he has done is actually totally wrong, and what he has spoken is totally wrong. So now what do? You have to comment.
I would probably...
Jousting, I think.
I'm going to communicate something which is very similar, which I had asked again another senior professor of mine. He said if the opinion is being taken to become one of his his what should we say, witnesses in case. He says, we normally tell them that I'm sorry, I cannot help you in that. This might have been something, but infections are feasible. And don't respond to that unless you get a court summons, because nobody can pull you into it.
Yes.
So the court
Yes.
summons you can't refuse, but a patient's request can always be refused.
Yes. Patient cannot directly take your expert opinion. It should come from a court or the inquiry committee where you can answer their questions.
Yeah, good.
But
Thank
Gautam,
you.
patient may not be a third party. Patient may be very close to you, and you know this is a definite greed on the part of that surgeon. And he has this is something which is very wrong, which he has done. That also you have to understand.
But I think
it's not so simple. I think it's not so straightforward in this particular situation.
But Girish, if I can interrupt here, it may be a case of failure to go ahead with laparoscopic or endoscopic hernia repair.
Absolutely.
And then this is the place where there is extreme importance of the record keeping, that the surgeon should have clearly mentioned in his notes that for whatever reason, the procedure could not be completed laparoscopically and so had to be converted. If he is open about it, there is nothing wrong in that, because yes, things can be such that one cannot proceed laparoscopically and has to do an open procedure. But
Can I give another example?
But patient was angry because patient was not taken into confidence. Probably.
Exactly. Then that is the wrong part on that's the wrong doing on the part of the surgeon.
Yeah, I think we have come to the end of the program. We thank you all our speakers for a very, very good insight to this subject. I think we're already reading comments that most of them have been thrilled to listen to the real world scenario rather than just the academic discussions. Gautam, my co-host, did the wonderful job. And I just request everyone that please log into our YouTube channel. All our previous 18 topics probably you'll be able to go through. And that is UMANG, the Empowering Medicos channel. And please subscribe it so that you, even in future intimations, you'll keep getting. And I end, in fact, this was a slide which was in fact put by Madam only on when the primary discussion was going on. That remember, we all stumble, every one of us, and that's why it's a comfort to go hand in hand. And in fact, that is probably the take-home message, that whenever possible, we try to, either minimize the damage to our colleagues, or if possible, avoid that. In case if not, then try to, of course, communicate what is the most ideal that time. And often the layman says that, you use a very bad comment, ko garmi chadi hai kya? So I just remember one particular saying by Gulzar, and I end by saying that, बरसात गिरी और कानून में इतना ही कह गई, गर्मी किसी के भी हमेशा नहीं रहती. So please remember that, and I think we end here and we meet you again next month with another thrilling topic and to give you more insight. Thank you all.